out for your part of it.
Sounds good. Alrighty.
Okay. So we're just doing the assessments because I've got all of that ready to go. And
yes, yeah. It would be like you administering the 9-hole peg test.
Okay. All right, we're gonna do it. Okay, so I'm gonna give you a little bit of instruction about the 9-hole peg test. So are you right hand or left hand dominant?
Right hand.
Okay, so you're gonna have the dish on your right side. Okay. And the aim of the game is to go as fast as you can. You're going to pick up the peg, put it in each hole, and then when you go to remove them, so you're gonna line them all up, and when you go to remove them, please remove just one at a time, not scoop them all up and put them in the tray. Okay. I'm gonna give you a practice round for each side. So right hand, we're gonna practice, and then we're gonna time it again for the real deal. Okay. Can I ask you a question really quick?
Go for it.
A couple questions that came up were, what happens when they're going so fast and the pegs fly out and hit the floor? Do we start over?
Time keeps running. You just help them back up the pegs because that's showing like we're going a little bit too fast. We don't have the sufficient control of like following directions. So it might be a cognitive issue that might be going on.
Okay.
So you can stop it again, redo it, kind of explain. You're doing it as fast as you can, but making sure it's not going to go fly everywhere. You might have to modify yourself as time goes on, but usually I have never had somebody like that has had all the pegs fly out.
Okay.
Sometimes like one will like slip down and like, okay, I'll grab it as they're like putting the other ones in.
Yeah.
It's not that big of a deal, but definitely like if it's a very obvious, like they didn't pay attention to the questions, they're like grabbing them all at once, that's something that you would want to stop fully and try again.
Okay, got it. And then does it matter if the pegs are in order, like first or second or third row?
It does not. That is completely fine. And also right now you have, like I'm going to use my phone as like an example because I have my practice here. You want the dish to kind of be on their opposite side. So if you're testing right hand first, it's going to be the dishes on the side. They almost have to cross midline, so they're doing this.
Oh, so I had it right the first time. Okay, so I was just watching back your video and I think I got confused on that. So I'm glad you said that. Yeah, so yes. Okay, so right hand, dishes on the left side, just reaching, crossing midline.
And then when you got the left hand, you flip it to the other side.
Got it. Okay, thanks. Probably should have asked those questions before we started. All right. So now we know dishes on the right side. So pick up individual one, put it in the hole, take it out, take each one out individually. And then when you pick up the first peg, I'll start the timer. So when you're ready. Okay. Nice. Right hand practice, 21 seconds, 97th of 100th.
The other thing I want to just mention, not all clients will need to do this. Some are completely fine just doing it with one hand. I will sometimes just let them know if they need to. They can use their left hand. So you're testing right, they can use their left to stabilize the pegboard. You kind of see how it's got like the little divots that stretch out?
Yes.
That's where a client can put their hand to stabilize the board if they've got nothing underneath it.
Okay.
Type of deal.
Thank you for reminding me. We just did the practice before, so that was just mentioned prior, but I did not say it for this presentation. So yes. And we talked about the stabilization, so left hand, and then I offered her dice sim, and she declined. So we're good. Yeah, thank you.
Yeah, that's completely fine. It's just something to always keep in mind, having it in your script almost.
Okay. All right, when you're ready for your real deal. Okay, we're going to do the left side practice. We're going to switch the board. You can stabilize with your right hand over here. And then let me know, or I'll just watch you when you're ready. All right. Okay. Nice. You shaved a couple, about a second or 2 seconds off of each one. So, is it okay to share with her about your lifetime? Okay. So, what I think is really cool is we were looking at the standard deviations for females before this, and I did it on another classmate. And so, their age range was like very much correlating with the score that they got. But Alyssa actually said that she has arthritis in her fingers, and her scores have been slower than the mean. So, I thought that was really interesting. So
I do have a question. With that left hand, did you notice how she was grabbing the pegs?
Was it like tip? Is it like this?
I don't know.
I did not. I wasn't aware. I would love to know.
Kind of get this practice. So let me find myself something I can. Okay, here we go. I have a pencil.
Okay.
Not the same length or anything as the peg, but when she was putting them in, she was grabbing it with 2nd through 4th and the first one on it. So this isn't a superior grasp of any type. Usually when we think of our fine motor, that is our index, our middle, and our thumb working together. And when she was taking them out, the index finger didn't even come into play. She was doing this.
Interesting.
Thumb, middle, and ring.
Interesting.
So those are some of those notations that you want to do when you are doing an assessment with a client on what type of grasp they're using. The most superior way would be tip to tip, using index and thumb. Like this. If they're using these 3, that's completely fine because these are the 3 that we use for our fine motor dexterity. Now, when you start seeing some funky stuff, and you will see some funky stuff because I have somebody with their pinky and put them in, and I'm like, all right, took them out. You did what I asked you to, but you definitely used not what the proper grasp is. Those are different things you want to note take. And of course, prior, want to make sure, like, just like, why are you here? If you're having any pain, like what could be maybe preventing you from being able to complete this assessment, or just kind of like the background things that you want to know. And you can even ask them after, like, how did that feel? Was there any pain while you were moving those pegs? Did you feel slow at any moment in time? Like, you want that subjective stuff to make a bigger picture of like what deficits a client is having.
Awesome. That's very valuable. Thank you so much.
Of course. And I don't know if you have any extra questions for me. I hope everything did run smoothly, because I know I had to go back a couple of times. Like when I first was making the module, I made everything like a little bit way too advanced of like giving you all the muscle names and everything. I'm like, you don't need that. You just need to know that there's 2 muscle groups here. Intrinsics are always going to be in your hand, and extrinsics are all the way out here, but like not all the extra mumbo jumbo.
No, everything was very helpful, and we are talking about all of this in our class right now for peds. We're doing all of the pincer, like all of the grasping patterns, and so it's actually really tying in at a really good time.
That's great to hear.
Yeah.
I'm so happy.
Yeah, thank you.
Excellent job. I know in one of my resources, like it directs you to the website Shirley Ryan.
Yes.
Keep Shirley Ryan as a extremely valuable resource for everything you do from here on to like practicing.
Awesome.
I use that like another Bible while I was out on my clinical rotations. Like if I didn't know an assessment, it gives a very good brief background of what you're doing. Sometimes it will even like link you off to the instructions on what to do with the assessment. And I know I included that in your presentation for the 9-hole peg test. So it almost like gives you a script for it. There's no proper script, but it like gives you an idea of like how you should be talking to your client, explaining what you're doing. I generally will have fun with it because this is something I did with adults. So it's like I'd even make a fool of myself. Like you're not trying to like grab them all at once. We're doing one at a time as fast as you can.
Yeah,
So
it is a very fun assessment. It really is.
Yes. It's very simple. It looks very dorky, and I've had clients tell me, it's like, what in the world is this for? And I'm like, dude, it says more information than I could like just look at your hands and tell you. So that's why we're doing this one.
Awesome.
And it's also something, keep in mind that it's not just an assessment. You can actually use it as like a genuine intervention, like to like challenge the client to like see if like, okay, well, do you remember how we did this the first time? Let's see how you're doing right now as part of the intervention that we're doing today before using it as a reassessment. So it's an awesome tool. I love the 9-hole peg test. It's one of the simpler fine motor ones. There are much harder ones out there that do frustrate clients, but this one in general, it gets along pretty well with everybody that I've done it on.
Awesome. Thank you for sharing. It's been a fun learning experience.
Yay, I'm so glad.
And yes, thank you for your lead and all of your information, all the annotations and all of your like the scripts, or how do I say it? Like your talking over the
Yeah, I
PowerPoints. It was
included
really
all
good.
sorts of like tidbits.
Yeah.
As much as I could to just send them over, and if you ever need like anything extra, let me know.
Thank
I
you.
mean, you have my email. I'm still very much an active grad student. God knows I'll continue to be an
You
active student
will.
because that's the profession we got into.
Yep. Yep.
So definitely, and I will double check on my end as well, like what papers I've got to do. Like I just put it up. It's essentially like the competency feedback form. So I'm thinking I'll just go ahead and send it to you.
Okay. Yeah, I can do that right now.
If you need it, great. You already have it. If you don't, well, I mean, it's just in the email there. Other than that, I've got no other comments. Just making sure that you remember prompting of like if you need to stabilize the board, use your other hand. Remembering that the dish goes on the opposite side of the hand you're testing. So if you're testing right, the dish is over here. So they're crossing midline slightly.
Okay.
Because for some patients, this is a difficulty when they're crossing midline.
Yes. All right.
So definitely something you want to keep in mind and just have fun with it. It's a very laid back assessment. We have some that are a lot more strict if you do have to follow a specific like time, be it 30 seconds to anything. This is completely client led.
Love it. All right. Thank you, Lizeth.
Of course. Happy to see you both. Have a wonderful rest of your day.
Bye.
Bye.
Okay, what's wrong with me?
Nothing at all.